So I just talked about MRD in the setting of a newly diagnosed patient. After combination therapy, if you're MRD negative, you could use that to hold off with a transplant and do a delayed transplant. You collect. If you're MRD positive, you move forward with transplant and then go to maintenance. So I think in our hands, about half the patients are MRD negative after combination therapy, collect cells, and go straight to maintenance therapy. So could there be other applications for MRD? Yeah, I do think there will be many as we move into the future. In fact, we just opened a clinical trial for patients that are MRD negative over time. And we have studied MRD for many years. So we have several patients that are MRD negative for 3 or 4 or 5 years even. If any of those patients were to develop MRD positivity at a later time point, the current standard, the current guidelines say that you should just follow the patient and do nothing. Eventually, the patients will have evidence of progressive disease, and if you don't start therapy, the patients will develop symptoms. So as we have been thinking more and more about these questions, we have questioned whether this really is the way to go. And all the new therapies we have, they are very efficacious, and many of them are not very toxic. Also, at the same time, the diagnostic criteria for myeloma actually put much more emphasis on biomarkers. So you don't have to be sick to be diagnosed with myeloma. So in our opinion, it makes no sense, maybe in the future, to handle relapse differently. Maybe you should think of MRD conversion as the time point to think about therapy. But because we don't know that, the right thing to do is to do clinical trials. And that's exactly what we have done. So we have developed clinical trials for patients that convert back from MRD negativity to positivity. And we give them a restricted duration of time of therapy for 6 months with monoclonal antibody in combination with an immunomodulatory drug. And then we check MRD status again. And the study has its primary endpoint to see that we can convert it back, and also to see if the longer term follow-up actually leads to the fact that you avoid a true progression. And that will be very interesting to see the results. And I think there will be more studies as we move into the future.